Hi, it's Patricia Coughlin. Oh, darn, I just did a whole video and it didn't record. So let's see if I can do it again. Okay, I decided to extend this topic of how to begin ongoing psychotherapy sessions. In the first video on this topic, I talked about how important it is to leave space, room for the patient to begin the session rather than you, the therapist, beginning it. So let's really talk about why we would do that. This is very important, not just to follow certain rules, but to deeply understand why we do what we do. So, in dynamic psychotherapy, we are there to discover the unconscious source of the patient's symptoms and suffering. And we do an intensive initial session called a trial therapy. And during that initial assessment, hopefully, we're coming to agreement about the nature of the problems to be addressed, the goals to be obtained, and the therapeutic tasks to get us there. So, since we've already agreed on that, right? Why would we ask the person again and again? It doesn't make any sense, number one, right? As if we didn't already agree on that. But number two, this is dynamic psychotherapy. So we want to be able to assess where the patient is when they enter each session. We're going to use the two triangles, the triangle of conflict and person, to assess this. Is the person coming in with anxiety on the forefront? Or are they in defense and resistance? Or are feelings right there, just under the surface? And is it in relation to you in the transference, to someone in their current life or the past, right? So you want to, as quickly as possible, assess where the patient is, and then you know where you want to get, which is to the bottom of both of those triangles, right? You want to eventually get to the avoided feelings in the current life that are related to unresolved feelings and conflicts from the past. Research suggests that making these kinds of connections, what they call connection cycles, where the current difficulty is directly connected to unresolved issues from the past, is highly associated with positive outcome. Furthermore, they find that making those connections in the early and mid phase of a session rather than waiting till the end is much more effective. So, the first thing that you want to be thinking about is doing that assessment in every single session. Where are they? You know where you want to go, and then you're going to formulate a way to get there. The other two things you have to keep in mind in every session is, what are the presenting complaints? And what is your case formulation in this particular case? So you're always keeping that in mind. And whatever is happening now, you're connecting to the presenting complaints. You also want to keep sort of the context and the phase of the treatment in mind. Are you just beginning? Are you in the mid phase of working through and consolidating change? Or are you approaching termination, right? You're going to want to understand the material in these contexts, and you're not going to just go into each session, right, as if it's the first or not connected to what's been happening. Maybe there was a particularly difficult session last week, or one that was really impactful. So we're going to be looking at how the patient comes in with that in mind. Right, so these are all going to help you not just to orient and to be intentional in each session, right? But it's also going to help you be much more effective and efficient. And interestingly, this newer research on these connecting cycles really is just validating and reinforcing research that was done decades ago by David Mallon at the Tavistock, right? And he found that therapists who were able to create an emotionally charged atmosphere and were able to identify the current conflict and connect it to unresolved conflicts from the past got by far the best results, and that was a much more powerful factor than the patient's diagnosis or their history. So these are really things you can do to improve your effectiveness and also, to boost your morale and to have more success. So I hope this is helpful to you, and I look forward to hearing back. Bye bye.